Your shoulder isn't supposed to hurt every time you reach overhead. Here's one gentle exercise that may help restore comfortable movement. Pain medication may temporarily reduce discomfort, but it doesn't always address why your shoulder hurts in the first place. That's why doctors and physical therapists often focus on restoring healthy movement. Today, you'll learn one simple exercise that may help your shoulder move more comfortably again. We'll also cover the daily habits that support healthier shoulders, common mistakes that often make pain worse, and when shoulder pain should be evaluated by a healthcare professional. Stay until the end, because the final tips could help you protect your shoulders for years to come. Point 1. One of the biggest mistakes people make after developing shoulder pain is stopping all movement because they believe rest is the fastest way to heal. While complete rest may be appropriate for a short time after a significant injury, avoiding shoulder movement for days or weeks often allows the joint to become even stiffer. Muscles weaken, the connective tissues lose flexibility, and everyday activities become increasingly difficult. That's why rehabilitation specialists usually encourage gentle movement within a comfortable range rather than complete inactivity. A simple exercise frequently used in physical therapy is called the wall slide. Stand facing a wall, place both hands against the wall at about chest height. Slowly slide your hands upward as far as you comfortably can. Do not force the movement. If you begin feeling sharp pain, stop before reaching that point. Pause for 2 or 3 seconds, then slowly slide your hands back down. Repeat this movement 8 to 12 times because the wall supports your arms. It helps guide the shoulder through a controlled movement while reducing unnecessary strain. Many people notice gradual improvements after performing this exercise consistently for several weeks. Remember, slow and controlled movements are far more beneficial than rushing through the repetitions. Point 2. Understanding why this exercise works makes it easier to stay consistent. Your shoulder is one of the most mobile joints in the body. That incredible flexibility allows you to reach overhead, throw a ball, lift groceries, and perform hundreds of daily tasks. But mobility also depends on healthy muscles, tendons, ligaments, and joint capsules working together. When pain develops, people naturally move their shoulder less. Over time, this reduced movement can create a cycle where stiffness increases, making movement even more uncomfortable. Gentle exercises help interrupt that cycle. Movement encourages circulation around the joint, helps maintain flexibility, and reminds the nervous system that comfortable motion is still possible. The goal isn't to eliminate pain immediately. The goal is gradual improvement through safe, consistent movement. Another area many people overlook is the shoulder blade. Your shoulder doesn't move by itself. The shoulder blade provides the foundation for nearly every arm movement. If those supporting muscles become weak or inactive, extra stress is placed on the shoulder joint itself. One simple exercise is the shoulder blade squeeze. Sit or stand with good posture. Gently pull your shoulder blades toward each other, as though you're trying to hold a small object between them. Avoid shrugging your shoulders upward. Hold for about 5 seconds, relax. Repeat this 10 to 15 times. Strengthening these stabilizing muscles often improves posture and allows the shoulder to move more efficiently during everyday activities. Point posture plays a much bigger role than many people realize. Hours spent looking down at phones or sitting with rounded shoulders can place extra stress on the muscles surrounding the shoulder throughout the day. Try keeping your ears aligned over your shoulders and gently opening your chest. Small posture improvements repeated consistently often make a noticeable difference over time. Point 5. Always warm up. Before activities that involve your shoulders, whether you're gardening, exercising, cleaning, or lifting objects, spend 5 minutes gently moving your shoulders through comfortable circles and arm swings. Warm muscles generally move more comfortably than cold, stiff muscles. Point 6. As your shoulder begins feeling better, strengthening becomes just as important as stretching. Light resistance bands or small hand weights can gradually improve shoulder stability. Progress slowly and avoid increasing resistance too quickly. If you're unsure which exercises are appropriate, consult a physical therapist. Point 7. Avoid sudden overhead lifting if your shoulder already hurts. Gradually increase activity instead of doing too much too soon. Point 8. Your sleeping position can influence shoulder discomfort if sleeping directly on the painful shoulder increases pain. Try sleeping on the opposite side while supporting the affected arm with a pillow. Point 9. Consistency matters more than intensity. 5 to 10 minutes of gentle exercise every day usually produces better results than exercising only once each week. Point 10. Use pain as your guide. Mild discomfort during rehabilitation exercises can sometimes be expected, but sharp, severe, or worsening pain is a signal to stop and seek medical advice. Point 11. Many people give up because they expect improvement within just a few days. Unfortunately, that's usually not how recovery works. Shoulder muscles, tendons, and connective tissues often need time to adapt. For many common shoulder conditions, noticeable improvements may take several weeks of regular exercise. Some people improve sooner, while others require a longer rehabilitation period, depending on the underlying cause. Instead of focusing on immediate results, pay attention to small signs of progress. Perhaps reaching into a cabinet becomes slightly easier. Maybe getting dressed becomes less uncomfortable. These small improvements often add up over time. Patience and consistency are two of the most powerful tools in shoulder rehabilitation. Point 12. Continue using your shoulder during normal daily activities. Whenever it feels comfortable, simple movements like brushing your hair, preparing meals, folding laundry, or reaching for lightweight objects all help maintain mobility. Completely avoiding these everyday tasks can allow stiffness to return. The key is choosing movements that stay within a comfortable range. If an activity causes significant pain, modify it or stop and discuss it with a healthcare professional. Gradual, comfortable movement is generally more beneficial than complete avoidance. Point 13. Although many cases of mild shoulder pain improve with appropriate exercise, not every shoulder problem should be treated at home. Seek medical evaluation if your shoulder pain began after a fall, accident, or heavy lifting injury. You should also see a healthcare professional if you develop significant weakness, numbness, swelling, redness, fever, or if you cannot lift your arm normally. Persistent pain that continues for several weeks despite appropriate self-care also deserves medical attention. A proper evaluation helps determine whether you need imaging, medication, physical therapy, injections, or another treatment approach. Early diagnosis often leads to better outcomes. Point 14. Healthy shoulders depend on healthy habits. Throughout your entire body, getting enough sleep gives your tissues time to recover. Eating adequate protein supports muscle maintenance. Regular physical activity helps keep joints mobile. If you have diabetes, maintaining good blood sugar control is also important, because poorly controlled diabetes is associated with an increased risk of shoulder stiffness. Avoiding smoking also supports circulation and tissue healing. Exercise works best when it's combined with an overall healthy lifestyle.